This is For the Better, a podcast for healthcare marketing professionals navigating change and innovation. It's produced by Reason One. I'm your host, Ben Cash. My guest today is Melissa Fors Shackleford, a 25-year healthcare marketing veteran who has held senior positions at Optum, Hazelden Betty Ford, and Cygnus Evernorth. She was most recently at Let's Get Checked, where she led marketing strategies that increase access to at-home healthcare and diagnostics, particularly for historically underserved populations. Melissa, welcome to the podcast.
Thanks for having me, Ben.
So I'm just going to dive right in. You've led marketing in some of the most complex areas of healthcare, from behavioral health to diagnostics, always with a strategic and ethical focus on access and inclusion. And I remember this in your book, Harnessing Purpose, A Marketer's Guide to Inspiring Connection. You advocate for something, you say, marketing as a force for good. And, that really resonated with me because Reason One is a certified B Corp, which I don't know if you've heard that. It's a global movement to use business as a force for good. In our case, we've committed to advancing health equity in the digital medium. I just want to dive into that. So what does it mean to use marketing as a force for good?
I think there's a lot of layers to that. And I love that you're focused on being a certified B Corp. I think that's so important. And from my perspective, as a marketer, I can be a force for good. As a leader, I can be a force for good. But ultimately, what I think marketers can do, because marketers are the voice of an organization, we can help our organizations be a force for good. And a lot of that, from my perspective, is how do we define what our values are? How do we live our values as an organization? It doesn't mean that we all have to be Patagonia and try to save the earth. That's wonderful. They're a great example. But the rest of us, whether you're doing B2B marketing or healthcare or any other industry, we can really define what are our values, what do we stand for, and we can be that force for good. And ultimately, it's really about connecting with your customer and building that trust. And when you're speaking to your values, you're living your values, and those values resonate with your audience, you're building meaningful connections.
Yeah, I love that. Well, how did you get into that? What inspired that journey for you?
I think about this a lot, and I think some of it started just really early experience. I think my first job after undergrad, I worked in Tokyo, Japan. And one of the things that they talk a lot about, not just in business, but in day-to-day life, is making sure other people save face. And part of that is you just don't embarrass someone else, you don't surprise someone else, but you put so much emphasis on how the other person feels. And you really value that other person. And I think for me, when I then moved back to the States and moved on with my career here, I always sort of thought about that end user customer and really valued them. Beyond that, I think as a person, I'm very mission driven just in my day-to-day life. And I wanted to seek out a role that for me, I found meaning and value and purpose in. I want to enjoy going to work every day. I want to feel like I'm making a difference. And I'm not a doctor. I'm not doing patient care, but I can still be part of the healthcare ecosystem from a marketing and communication standpoint.
Yeah, it can often be challenging, especially for large organizations and health systems, to get things done, move things forward. And we all have lofty goals and want to be a mission-driven force. But from practical terms, can you maybe share a story of where the rubber met the road?
I first started in healthcare as part of United Health Group. And massive, Fortune 20 company. But even though they have all these different sides, largest health insurer in the country, I every day felt the organization's mission to really help people live healthier lives. I mean, I really felt that. And even in marketing, even though I was a B2B marketer there, so I was selling to other organizations, I still felt that ultimately all of us together we're helping people to live healthier lives. So I could really feel it. But from there, I went to a provider in the behavioral health space. And I worked for a long time at Hazelden Betty Ford, which is the nation's largest nonprofit substance use disorder and mental health organization. And there, obviously at a provider organization, you really feel that you're doing good. You are helping the end user, even as a marketer. And one of the things that I found at Hazelden Betty Ford was that when you dug into the data, our largest competitor wasn't another institution. It was families that did nothing. And that's where I saw that there's a lot that I as a marketer, my team as a marketer, and we as a collective can do to really break down those barriers and create more access for families, whether it's substance use disorder, mental health, or other conditions. We can help them get care. And I tell you that for me just really stuck with me. And I've been such a champion to making sure people have access, whether the problem is around it's a health equity issue, it's an accessibility from someone living with a disability, if it's from inclusivity, lots of different things, breaking down the stigma to get people the care that they need.
Yeah, and actually that makes me think of the work that you did at Let's Get Checked, which was trying to expand access to virtual care and diagnostics for underserved communities. And, it makes me think about what are these communities and who are the communities that Let's Get Checked was serving, filling those gaps. Because we live in a time where concepts like DEI aren't fully understood, right? And there's those with some ulterior motives who are redefining it in that vacuum. And so I wanted to just define the basics. So when you say underserved populations, who and what are you referring to?
I'll just start by saying everyone is a healthcare consumer. So all of us are. When we talk about underserved communities, especially the ones that Let's Get Checked really enabled people to get their healthcare at home. So when you think about people in rural communities that have pharmacy desert, they don't have the same sort of like I live in the city and I have healthcare. I could walk to my doctor's office if I felt like it. So we have the rural populations. We have people without a lot of access when you're talking, whether it's Medicaid populations, people with low health literacy, where they may not have a very high reading level. And so that's one of the reasons the American Medical Association wants us to level of the reading level of all the communications we put out. So it might be people with a low, reading level. It might be people with English as a second language. And it's often with stigmatized conditions. So one of the most popular at-home tests that Let's Get Checked offered were sexual health testing. And so oftentimes people feel a little stigmatized or concerned or embarrassed, and they don't want to go into the doctor's office and announce that they want to get sexual health testing. So those are things that you can do at home. It breaks down the barrier. People still can get the care that they need, and they don't need to go into the office. You also see this with the transgender population. Sometimes they've received a lot of stigma and bias when they're going in, and let's say some of their medical records don't match how they're currently presenting. And so then they're running into these hurdles and they don't want to go in and feel this stigma and the shame from going into an office. So can we enable them to get their healthcare from home? That's where there's so many providers like Let's Get Checked who are starting to simplify it. And it's also taking a lot of cost out of the system.
Yeah. And you get to something at the heart of this, which is trust, right? It says like people they're going to have trust in their providers, trust in the system, that if they seek care, they're going to be taken care of. It feels like one of those areas where a marketer as a communicator could really make a difference. So from your perspective, what are the biggest barriers to building trust and connection, whether it's language, health literacy, the digital divide, or realities of rural and socioeconomic access?
I think accessibility is one just for a lot of people. When you think about somebody who's deaf or hard of hearing, well, lots of hurdles to get your healthcare. But again, if we as marketers really lean into accessibility in our communications, well, there's most of the information, we close caption our videos, we do all the things. Someone who's deaf or hard of hearing should be able to get a lot of that information at home. When we think about stigma, is something I just feel really passionate about, especially because I spent so many years in substance use disorder and mental health, that a lot of times families don't want to get care because they're ashamed. What will the neighbors think? What happens if we'll find out my child needs care for this or that condition? And it goes beyond substance use disorder and mental health. It could be HIV, AIDS. Oftentimes it's been diabetes and obesity, although the conversation is starting to shift. And I will say that's a lot of marketers who are making that change of that conversation. These days, we're having conversations about obesity and weight loss medication. So we're starting to see a change there. We're even starting to see the change with HIV a little bit just by a lot of marketing campaigns that you see. So there's all these barriers, but oftentimes marketers are the ones who can help that. Think about we have so many people in this country where English isn't their first language. So how do we make sure they know that they're welcome at our healthcare institutions? And part of that is by having their first touch, having the website, having the apps, having any of the communication that they receive, be it a grade, a reading level that you can understand, using lots of graphics and diagrams to help them that you don't need any sort of language, but also offering a second language. It's not that hard. A lot of that should be table stakes just from an inclusivity and accessibility standpoint these days.
Yeah, agreed. And I think accessibility often gets reduced to compliance, right? But it's a lot more than that. So, are there any other recommendations or tips that you would provide to marketers that you think would help them build better, equitable experiences?
I think we've got a lot of the basics, and we're doing pretty good as a community these days. When you think about your visuals, making sure that just because everyone is a healthcare consumer, making sure we're showing people of all shapes, sizes, races, religions, ages, gender, everything. We're showing everything we can in our imagery. So people say, oh, well, I look like that. Maybe I'm welcome here. Making sure, of course, things are accessible so that if you're living with some sort of disability, that they know that, oh, well, they value me because they're closed captioning, or they value me because they're using alt tags, or they value me because their app is very accessible. Another thing is language. You mentioned language. Language, it seems so simple, but it's really so important. When we think about substance use disorder as one, oftentimes people still say substance abuse. Well, it's a judgmental term. It's so judgmental. And if an organization just switches from substance abuse to substance use disorder, it takes a lot of that out of it. Also, it's really easy to use person-centered language so that you don't call someone their disease. You don't say he is cancer. You say he has cancer. So why don't we do that with all these other health conditions? Why don't stop calling someone obese? It's someone who has obesity. And because we have weight loss medications for people who have obesity because it is a medical condition. It's how do you take the person out of their condition? They are not their condition. They're a person with a healthcare condition. They aren't schizophrenic. They have schizophrenia. It's just a little bit different, but it's very respectful. You always have to think about asking that particular community. How do you feel most comfortable being referred to? Like, I recently met a woman who has autism, and she said oftentimes the autistic community prefers to be called autistic versus saying they have autism because they find it part of their core identity versus the condition. That was relatively new for me to learn. I love that. I respect that, but I also understand there's no one community is a monolith. And so we have to really dig in and make sure people feel welcome. And so I think language, imagery, accessibility, those are all kind of table stakes to make sure people can see that they're welcome to get this care. And even if they're getting their care at home through an organization like SkidChecked or one of the virtual care providers like Teladoc, so you can get most of your care at home, it's still, you need to feel welcome to use any of those organizations as well.
For sure. And you were talking about sort of that first step in the experience, right? They're seeking care, they're learning, and they're hitting that first digital touch point. You've probably seen this shift in healthcare marketing where it's no longer about reaching the audiences, it's about serving them, right? Digital healthcare experiences are not just communicating, you're actually shaping aspects of real patient care, from telehealth onboarding to e-visits, et cetera. You're actually providing care. And so I'm curious, have you seen this shift impact the expectations placed on marketing teams?
The expectation the marketing teams were all throughout the window when we got Netflix, because people expect an experience like Netflix or even Amazon from their healthcare, and we're not quite there. But I feel like that's the expectation. They expect us to provide a personalized experience. They expect us to know them. They expect us to do things like on Amazon. I love the recommendations they give me. On Netflix, I love the recommendations they give me because they know me and they're communicating to me in a way that I want to be communicated. And so that's the same thing. The general population has a whole different set of expectations for us as healthcare marketers these days than they did even 5 or 6 years ago. It's very different today. The demands on us to be spot on our communications, to know that the person would prefer Spanish, to
Right.
know everything about this person, and to beyond that, to be as respectful and welcoming as we possibly can, because people deserve to be able to get the care that they need.
Empathy is now table stakes. Oh,
It's sad, but it really has become that way.
and so in your book, you talk about marketing as a profession filled with purpose. What does that look like in the healthcare space where the stakes are often so personal and so high?
Ultimately, marketing is one person communicating with another. And even if it's B2B marketing or you're talking about some large institution, it's still ultimately you're speaking to people. And that's where I found that marketing can be a profession filled with purpose and meaning. I started my career very early on at Fortune 50 manufacturing companies, just very large global behemoths that were manufacturers. And yeah, I found purpose in my role because I loved my team. I loved the customers. I got to know them. And I found that it's really how do I communicate with those customers? And same in healthcare. When I found healthcare, I never left because I just found so much purpose and meaning. And it really resonated with my core values. I want to be of service where I can. I'm not a nurse. I'm not a doctor. I'm not a psychologist, but I can still bring value. And I think when we as marketers really think about leading with the empathy, like you just mentioned, and putting our customers first, whether you're selling to a health plan, you're selling to a healthcare institution, you're selling a digital healthcare provider, you're doing all these things, but it's still you're speaking to people. And another way that I think that we can bring a lot of just a purpose and meaning into what we do is leaning into the storytelling. And that's what marketing is at its core. And when we lean into storytelling, whether it's, you know, patient testimonials or in a B2B world, it's client testimonials, you're telling stories of people. And that's what resonates with consumers and your customers on the other end.
Yeah, so true. Well, clearly you're very passionate about using marketing as a force for good. I'm curious, who inspires you? How do you nurture yourself? Who do you listen to?
When people ask me, like, who's doing a great job breaking down stigma, focusing on inclusive marketing, I will say some of the HIV pharma organizations. I feel like those marketers have changed our societal narrative around HIV. I mean, a few years ago, you would have never dreamed that you had commercials for HIV drugs all over every NFL game. And now you do. And they're showing real people thriving, living their best lives. And they're reinforcing the more modern take on HIV and HIV medication is that you can be undetectable and untransmittable. I mean, it's changing the societal narrative. Yes, they're communicating to people they want to buy their medication. Yes. But they're also talking to the rest of the world and saying there's a new norm. And these are people that they're showing getting married and living their best lives. I find that so inspiring. I don't know anybody who works. I'd love to like collaborate with them at some point. I think that's wonderful because they're changing the narrative in our country. And that I want to do things like that. I think that's just inspiring.
Changing the narrative, but also leading with respect,
Think
right? You're respecting the people that you serve. You think that would be just sort of obvious, but in today's world, it's not.
it's really sad. When you think about marketers, yes, we're become so data driven. Yes, we're so focused on analytics and personalization these days. Yes, that's all true. But ultimately, at the core, it's really communicating to human beings. And so when we think about it that way, leading with empathy, and when you talk about like marketing as a force for good, it's not that hard when you think about connecting and building meaningful long-term relationships with people. And I think about like who else inspires me. I will tell you the last few years, because I really have, as a personal value, really tried to lean into accessibility. And so I follow all these creators on my social media feed who are people living with different disabilities because I learned so much from them. I think it's so important. And there's some wonderful, wonderful creators. There's one woman that I recommend people follow on LinkedIn. She does so much around accessibility and marketing to the disability communities. Her name is Kelsey Lindell. She's the CEO of Misfit Media. It's an agency focused on accessibility and inclusivity for the disability community. I find her super inspiring. I've learned so much from her. And one of my favorite creators, especially on LinkedIn, I think she's just amazing. And for me, it's just learning about different communities. It's been so helpful to me personally to bring all of that kind of knowledge and, for me, excitement about different communities into my marketing because it just helps you have a different sort of lens into your marketing.
Yeah, 100%. I just got connected with Chris Hempel, who's phenomenal and made me aware of this Billion Persona project, which is trying to bring in more diverse personas into AI to influence AI and create better, more inclusive AI models. And I just love the people that are out there, on the forefront. I'd love an introduction to the agency you
Yeah,
mentioned.
yeah,
That's
I'd love
really
to.
exciting.
I'd love to. I think, and she'd be an amazing guest on your podcast. And Chris is an amazing leader, and he is doing so much because right now, if I type into one of the AI tools, show me a CEO, well, it's going to be a 60-year-old white man. And that's just how it goes. And so it's really kind of horrifying to know that. And that's where people like Chris are really leading the charge and making people aware that we need to do these efforts, especially as we lean more into AI.
Great. Well, thank you so much for joining the podcast and having this conversation with me.
This was great. I really enjoyed our conversation, Ben.
If people want to get in touch with you, work with you, or follow you, how should they do that?
The best way is to reach out to me on LinkedIn, Melissa Fors Shackleford. I love to connect with people. I love to have conversation. And they're welcome to go to harnessingpurpose.com and learn more about my book.
Excellent. Thank you so much.